We are doing a letter now. First of all, we'll go down and read the writing task. Using the information in the case notes, write a letter of referral for further treatment to pulmonologist Dr. Andrew Kretzer. Address is given. So we are referring a patient to a pulmonologist. Right. So let's see who the patient is. Let's go up. It's given that we are the registered nurse of this clinic. Mrs. 𝗘𝗚𝗟𝗚𝗟𝗛 presented to the clinic complaining of shortness of breath and a persistent cough. Date of birth, height, weight, allergies are given. So patient's name is Mrs. 𝗘𝗚𝗟𝗟𝗚𝗟𝗛. Now regarding her social history, she lives with her husband. Husband is a non-smoker, likes gardening, doesn't drink or smoke, sometimes takes 𝗘𝗡𝗚𝗚𝗟𝗏𝗏. Family history, none to report. Alright. Now remember that we are writing this letter to the pulmonologist. So here, lives with a husband, this is not important. So we can avoid that. Husband is a non-smoker. We're focusing on the patient, right? Not a husband. So we can avoid that. It's not relevant. Doesn't drink or smoke. At the same time, she takes 𝗘𝗡𝗚𝗏𝗏𝗏. We'll include this too. Alright. Medical history. There are some history like diabetes mellitus, hypertension, stomach ulcers, ankle injury, and COPD. Now, we'll be just writing about the COPD. Now, regarding the medications, nothing related to COPD, so we can avoid that. So what she presented with, she presented to the hospital, no, to the clinic with intense coughing, pain in the chest, shoulder, and back pain, shortness of breath, change in voice, harsh sounds with each breath, change in color, and volume of sputum. Right. So this is important. We need to organize them together and write a sentence, maybe one or two sentences. Right. Regarding the diagnosis and examination, we took a chest X-ray, which was not clear, so we proceeded to a CT scan, which was positive for lung cancer. Right. Stage 2. Tumors 5.5 centimeter. Cancer cells spread across lymph nodes. Right, so let's write this letter. Now, as always, we'll write the recipient's name, Dr. Andrew Kretzer. Then the address as follows: City Hospital, 27 High Road, Newtown. That's it. Now we leave a line, we write the date. Possibly today's date, right? We leave a line, we write the RA section. We are referring. Patient's name was Mrs. 𝗘𝗚𝗟𝗟𝗏𝗏𝗏𝗏. We put a comma. DOP 18 March 1972. Now we'll write the introduction. As this is a referral letter, we can start like I'm writing to refer Mrs. 𝗘𝗚𝗚𝗟𝗏𝗏𝗏𝗏. Oops. Before that, the salutation. Yeah. So, dear Dr. Kretzer, now we come to the introduction. So where I was, yeah. I'm writing to refer Mrs. 𝗘𝗚𝗚𝗟𝗏𝗏𝗏𝗏. Now, from the case note, it is evident that we don't have to write a lot of things in our letter. So we'll elaborate as possible as we can, but make sure that we do not write a story. So I am writing to refer Mrs. 𝗘𝗚𝗚𝗟𝗏𝗏𝗏𝗏. We put a comma. A middle-aged woman, right? She would be something 44 or 45, something like that. Or else you can write the age. A 44-year-old woman. Something like that. Alright, after that we put a comma. Into your care for further assessment and treatment. Now, she was diagnosed with lung cancer during the hospitalization. This was a recent diagnosis. And it's quite important that we write this thing, the diagnosis, in our introduction. So let's write, she has been diagnosed with lung cancer. Right, so our introduction is done. We have the purpose, just an overview of our purpose and the diagnosis. So our purpose is clear and the diagnosis, that's clear. So that makes a very simple and clear introduction. Coming to the first body paragraph. So what's important next? What's next? Definitely it is what she presented with. This is something important for which the pulmonologist is curious to know about. Alright, so let's see the case note. Intense coughing, pain in the chest, shoulder and back pain, shortness of breath, change in voice, harsh sounds with each breath, change in color and volume of sputum. So there are a lot of things. We cannot make we cannot write down all of them one by one in one single sentences. That won't read good. This indicates that your writing ability is that poor. So we need to have some organization here and there. Alright, so what we can do, the intense coughing and change in color and volume of sputum, we can write these two things together. Mrs. Eaglestone presented to the clinic with complaints of intense coughing associated with change in color and volume of sputum, comma, shortness of breath and change in voice. That's done. Or else, you can make use of colons here. Mrs. Eaglestone presented to the clinic with the following complaints. We put a colon. Intense coughing with change in color and volume of sputum, comma, shortness of breath and change in voice. Right, the next thing, pain in the chest and shoulder. Back pain, that's not important, but we can write or we can ignore, that's alright. So she also had pain in the chest and shoulder. Now, is that correct? Pain in the chest and shoulder, that's wrong. We cannot say pain in the shoulder. Pain in the chest, that's correct, but pain in the shoulder, that's not correct. Right? So pain in the chest and over the shoulder. No, and around her shoulder. Around her shoulder. Right, after that, we can put a comma and write and. Complained of harsh sounds in each breath. Now, what we can do, we can write about the examination in this paragraph itself, but the paragraph will look lengthy. So let's make a new paragraph of that. Here we go. We have made a new paragraph. Here we write about the examination and about the diagnosis in detail. On examination, we put a comma. Chest X-ray revealed unclear results. Right. In the case note, it's given not clear. So we have just transformed into sentence like chest X-ray revealed unclear results. And it's given CT scan. Then we proceeded to a CT scan, which was positive, which had positive results for stage 2 lung cancer. So what we can do, we can put a semicolon and we can just elaborate that thing. Consequently, comma, a CT scan was conducted. That's done. That completes its sentence. Now we are going to write about what the CT scan showed. The CT scan confirmed positive because we cannot Continuing the same sentence, the sentence may look long, and this may confuse the reader, right? We cannot include a lot of parts in our sentence in one single sentence. The CT scan confirmed the diagnosis of, now why we are writing the diagnosis, because we have already mentioned about the diagnosis in our introduction. So we are writing the diagnosis. That's a specific information. That's the reason we have wrote the diagnosis. So the CT scan confirmed the diagnosis of stage 2 lung cancer. Right, so in the introduction, we just wrote about the lung cancer. So we have just elaborated it. We have not repeated the information, but we have elaborated the information. Stage 2A lung cancer. Right, after that, it's given about the tumor. So what we can do, let's write down, we put a comma, with a tumor size of 5.5 centimeter. Also, we can put a full stop, and we can make a new sentence. The tumor size, the tumor currently measures 5.5 centimeter. We put a comma, and cancer cells are spreading across the lymph nodes. Right. So that's done. That completes this paragraph. Now, the next thing is her medical history. So as given in the case note, we just see that we have just seen that there are a lot of history. So we are just focusing on the COPD. So her medical history is significant for problems related to COPD since 2012. Now, it's important about the smoking, as well as drinking, as well as about the 𝗘𝗚𝗚𝗟𝗚𝗚. Right. So we are going to include this in the same paragraph. Her history, as well as her what she is habituated to. Now, regarding the smoking and drinking habit, she doesn't drink or smoke. That's given in the case note. Now, if you are writing a letter to a district nurse or to a social worker, someone like that, then if in the case note it's given that the patient does not drink or smoke, you can avoid that. You don't have to write that. If the patient doesn't drink or smoke, you don't have to mention that thing in your letter. But over here, the case is different. You're writing this letter to the pulmonologist. So the pulmonologist, it is quite essential to write that she doesn't drink or smoke. The pulmonologist is curious to know about that. So we'll write, Mrs. Eagleston doesn't smoke or drink. Put a comma. However, we put a comma again. She has an habit of taking 𝗘𝗚𝗚𝗟𝗚𝗚. Okay, in the case note, it's given sometimes, so let's change it. 𝗘𝗚𝗚𝗟𝗚𝗚 on occasions. So we have written all the important things, right? As per what the pulmonologist requires to know about. Now we come to the last part. Now, what I can always the last paragraph. We are elaborating our purpose, right, or our request. So we should make sure that while writing the introduction, you just write an overview of your purpose and you elaborate it with proper wordings and sentences in the last paragraph. So what I've thought in the beginning, I've write about this thing. I can include this thing, pulmonary function, in my last paragraph. So I will just write it down here. Considering the above, comma, it would be greatly appreciated if you could assess Mrs. Eagleston's pulmonary function and provide suitable treatment. Here we go. We put a full stop. Yeah. So you have your own style, and Make sure you write the sentence properly without any grammatical errors so that it is very clear and easy to understand by the reader. So that's done. Now we will leave a line. We write the final sentence. Please contact me with any queries. Yeah, before that, this letter is something which are some certain assessments and examination report. So we can just include this line, all the pertinent details. No, all the pertinent documents are enclosed herewith. Right. So we put the full stop. Please contact me with any queries. We leave a line. Yours sincerely. We leave a line again. Registered nurse. In the case note, it's given registered nurse. So we write registered nurse.